Welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Real glad that you could join us for another segment. In this segment, we're going to be speaking with Dr. Arnold Saperstein. He's joining us here as Chief Medical Officer at Cecelia Health in New York to talk about type 1 diabetes and the challenges that children and adolescents have managing their condition. Families, caretakers, and the patients themselves need continual education, monitoring, and access to consistent health care for optimal health outcomes. Now, Cecelia Health and UBMD Pediatrics are working together on a clinical study to increase access to health care for rural and underserved populations, while also evaluating the financial viability of providing remote care management for children living with type 1 diabetes. Welcome to Health Professional Radio, Dr. Arnold Saperstein. Thank you so much for your time this morning.
Thanks so much for inviting me.
Tell us a bit about yourself, if you would.
Sure. I'm an internist and an endocrinologist by training. I'm currently the Chief Medical Officer of Cecelia Health. I oversee a large team of certified diabetes care and educational specialists that are nationally certified, and they consist of registered dietitians, registered nurses, physician assistants, and our expert clinical team report up to me. I set their overall clinical guidance and credentialing and clinical programming. But by training, I'm an internist and endocrinologist. I spent most of my life on the administrative side. I was Chief Medical Officer of a couple of health plans, spent 25 years at MetroPlus Health Plan in New York City as Chief Medical Officer, and then as President and CEO for the last 15 years. And most of my career has really been focused on overall population health, how to improve quality outcomes, how to improve both efficiency of care as well as quality of care. And I've just continued now moving from the health plan side to the provider side at Cecelia 3 years ago, and it's been a real positive experience.
When it comes to type 1 diabetes, explain briefly how it differs from type 2 and talk about some of the challenges that specifically children and adolescents have to face living with and managing this condition.
Certainly. So type 2 diabetes is by far the most common type of diabetes. You know, there are currently about 34 million people in the U.S. with diabetes, and the majority have type 2. And those individuals are not insulin dependent. They can be treated by diet, they can be treated by oral medications, or by insulin. You know, I have a lot of crossover in the overall management. But on type 1 diabetes, those are the majority are children. They are children and adults. They are fully insulin dependent, so that if they don't get their insulin at appropriate doses and appropriate management, they can actually go into diabetic ketoacidosis, which is a life-threatening type of condition. The other real challenge for children is that for the type 1 diabetes is that it's kids, a lot of young people. And young people are, having a hard time. They have a lot of friends. They're at different diets, much more freedom to go and not worry about having to be on the medications. So there are a lot of challenges for the kids to adjust, to learn how to manage their diabetes. Also with younger kids, very young kids that, have different, are not fully communicative yet, and you have a challenge of being able to manage their diabetes just by looking at their numbers without really being able to explain to them what's happening to them. So really it's a very collaborative effort of both the kids and their parents, guardians, to help them understand how to manage the diabetes. But the ultimate goal really is being able to live as close to possible, fully normal life, even though they have diabetes. And that's one of the things that we work on at Cecelia Health, is being able to help individuals manage their diabetes so that they could live a full and healthy life, even though they're managing a chronic disease at the same time.
So it seems like everyone involved in the child's life, at least until they become an adult and can live on their own, has to be continually educated, updated, and extremely vigilant, paying attention at all times for the entire time that the child is in their care, or at least in their home.
Very much so. It requires a lot of attention to make sure that the child's numbers are okay and that they're getting the appropriate dosing of their insulin, so that they're not going too low and they're not going too high, and that they're not going into any dangerous form like DKA or any severe hypoglycemia, which is very low glucose level. So yes, it requires tremendous vigilance of the parents and guardians and everybody surrounding it. And also, when the child goes to school, the school needs to be informed and being able to catch things before they occur, as they're occurring, to make sure that the child does well. So there's a lot of training that goes on to be able to manage a child with diabetes.
Now, I mentioned that Cecelia Health and UBMD Pediatrics are working on a clinical study to increase access to healthcare for rural and underserved populations, while at the same time evaluating the financial viability of providing remote care management for these children that we're talking about with type 1 diabetes. How does remote care management actually work, and is it a replacement or an enhancement to whatever current level of care that patient is receiving?
It's supplemental and clearly enhancing the care that an individual is currently getting. So Cecelia Health worked with UBMD early on during the COVID pandemic, where they were forced to move out of their clinics into a remote environment. So we helped, through actually a different grant of the Helmsley Charitable Trust, where Cecelia Health was hired to provide remote care. So we worked with the children who were old enough to understand, and the children and their caregivers, to provide them the core education of how you're managing your diabetes. We also helped them with the technology, being able to understand the tools that they have, like, for instance, continuous glucose monitoring or their insulin pumps, how they worked, what do the numbers mean, explaining their medications to them. And the UBMD team found it very, very helpful that we were able to provide a lot of support at the time on a remote basis by audio and video to these parents and children, so that when they had their remote visits, their virtual visits with their physicians, those visits were much, much more effective. Now, the UBMD study that we're doing now is it's 3 levels. So the first level is we're looking to see individuals who don't have broadband access. And can we, if we provide them with an iPad with broadband access, so there's part of this individuals have it, part don't, if we provide broadband access, which is not readily available throughout the country, will there be a difference in the quality of their outcomes if we're able to get better access to them to be able to do these remote visits? A second piece of the study is we're also utilizing databases for social determinants of health for individuals that might not have access to appropriate nutritional services. That we have access to databases with social services to help individuals get those services. But then a very important part is also the financial viability. So CMS, the Centers for Medicaid Services from the federal government and all, have realized that through the pandemic that virtual care is the direction that medical care is going. So with our supplemental care, our services can actually be billed to insurance companies for the services Cecelia Health provides in collaboration with the physicians. And part of the study is, can we develop a fully financially sustainable model whereby remote supplemental care entities or chronic care management entities such as Cecelia Health can actually work in collaboration with practices all over the country and provide, as you mentioned, these both supplemental and enhancing services, not replacing what happens in the doctor's office, but really providing the support and education that physicians' offices currently do not have the time or the staff to provide. And if we can make this financially viable, this could open up accessible remote care to people living with diabetes all over the country.
Well, I'm sure our listeners would like to learn more about Cecelia Health. Give us a website where we can do just that.
It's CeceliaHealth.com.
And that's CeceliaHealth.com, correct?
Correct.
All right, great. It's been a pleasure speaking with you, Dr. Saperstein. Thank you so much for your time this morning.
Thank you so much for inviting me. Have a good day.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Arnold Saperstein, the Chief Medical Officer at Cecelia Health. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/healthprofessionalradio.